Let's begin with a clinical vignette. A 40-year-old male, John, is brought to emergency room after sustaining injury on road traffic accident on the right side of the neck. CT scan revealed damage of lateral spinothalamic tract by bony fragment. Which of the following is most likely to be affected?
So now I'm going to highlight some important difference between the lateral spinothalamic tract and the dorsal column medial lemniscus. So both of these tracts are the sensory ascending tract. So the sensation that is carried by the lateral spinothalamic tract is the pain and temperature, while the sensory sensation that is carried by dorsal column medial lemniscus is the pressure, vibration, fine touch, and proprioception. The pain and temperature sensations are carried by the sensory receptor, and these sensations enter the spinal cord through this dorsal root ganglion. Next, these sensations the crossing over at the level of the spinal cord in case of the lateral spinothalamic tract, while in case of the dorsal column medial lemniscus, the crossing over takes place at the level of the medulla. The significance of this, so any damage at the level of the spinal cord will affect the sensation of the opposite side that is carried by the lateral spinothalamic tract, like pain and temperature. So after these fibers crossing over to the opposite side ascend as an interior white commissure and synapse at the level of the thalamus, and then these fibers terminate at the primary somatosensory cortex that is present at the post-central gyrus of the cerebral cortex. Post-central gyrus, that is also known as the primary somatosensory area, primary sensory area. Now I'm going toward the dorsal column medial lemniscus. The dorsal column medial lemniscus, the sensation like pressure, vibration, fine touch, and proprioception are detected by the receptor, enter the spinal cord through the dorsal root ganglion, and ascend uninterrupted and at the level of the medulla. Next, at the level of the medulla, these fiber crossing over to the opposite side and ascend as a medial lemniscus. So the medial lemniscus is basically the fibers that cross over in the medulla. So these medial lemniscus synapse the thalamus and then ultimately ascend at the post-central gyrus of the thalamus. So the significance of the crossing over is that any lesion of the dorsal column medial lemniscus that is below the medulla will affect the ipsilateral side, while any lesion that is above the medulla, in case of the dorsal column medial lemniscus, it affects the contralateral side, while in case of the lateral spinothalamic tract, the crossing over takes place at at this level of the spinal cord. So the any lesion at the level of the spinal cord will affect the lesion of the opposite side, the contralateral side. These are some important difference of the uh, lateral spinothalamic tract with the dorsal column medial lemniscus.
The right option of this clinical vignette is a pain and temperature from the left side. So why it is not pain and temperature from the right side? Because as we know that the lateral spinothalamic tract cross over at the level of the spinal cord. So any injury at the level of the spinal cord will affect the opposite side. So injury on the right side of the neck. So the answer will be the left side, contralateral.